My name is Perez, and I am the Director of Vida Guidance Center and a licensed clinical social worker. And this is my colleague, Fatuma Murray, a licensed clinical social worker at Urban Health Plan. Urban Health Plan is a network of community health centers with locations in the Bronx, Corona, Queens, and Central Harlem. We know that the COVID-19 pandemic and that the outbreak of racial injustices has caused major disruption in daily life, and children are feeling these changes deeply. We understand that the main priority at the moment is to continue controlling the spread of COVID-19. Nonetheless, we also feel that it's extremely important to call attention and focus on some of the repercussions of the pandemic on children's mental health. While returning to school may be exciting for many students and parents and caregivers, others definitely will be feeling anxious or frightened. Our goal today is to provide some tips that would help parents and caregivers work closely with the children in order to navigate some of the complicated emotions that they may be facing with going back to school. We understand your confusion. Trust me, we do. Hoping to provide education or at least remind parents how they can help their children cope with their emotions during these difficult times. So please join us today. We hope that this is helpful, and thank you for your time. I'm going to pass it on to my colleague, Fatuma. Thank you so much for being here with us today.
Thank you, Janelle. My name is Fatuma Murray, and I'm a clinical social worker. I work at the Adolescent Clinic, and I provide individual psychotherapy as well as group therapy, focusing on topics such as anxiety, depression, social skills, self-esteem. I also work at the Equality Clinic. So one of the things that a lot of my patients, as well as their parents and caregivers, have expressed over the last few months are concerns regarding what their life is going to look like in September, particularly in relation to school, in terms of what are some options that will be most useful and helpful for their family. So Janelle, what would you say are some recommendations for parents when making a decision of what learning options that might be available to them?
Of course. So we know that men's caregivers and guardians face new and difficult choices about how their child will return to school in the fall, such as deciding between in-person, a hybrid schedule, and or virtual home learning. When you make your decision about your child returning to school, it is important to consider your family's unique needs and situation, and your comfort level with the steps your school is taking to reduce the spread of COVID-19. Let's keep a few things in mind. Just because a service or option is available, it does not mean you have to take it. Go with your gut feeling and do what you believe is right for your child. I know it's not an easy decision, especially when everyone has a different opinion. But don't be afraid to go against the grain or make a different choice that is in the best interest for your child and the family. Also, remember, we cannot predict the future with certainty. So no matter how hard we try, we just can't, especially during these difficult times. What's important right now is making the right decision at this moment, right? And remember, you can always reevaluate that decision and change it into something else later on. And lastly, it's important that you keep the developmental level of your child in mind when you're making an educational decision, because you know best your child's need. But remember, there's no wrong decision, because at the end of the day, you're making that decision with love, and you're making that decision with your child and your family's best interest.
Yes, no, totally, Janelle. As you stated, parents and guardians, you are the expert in your children's lives, and something to keep in mind in terms of the social emotional needs of each child. So one option may be appropriate for one child, but it may not necessarily be appropriate for the other. So keeping in mind, what are their individual needs? So you may have a child who deals with stress a little differently, maybe have a difficult time with transitions and changes. So maybe you may want to consider homeschooling that child and having that child do remote learning. Whereas you may have another child who's very adaptable to changes and may work better in school. So there are different options available, and you can reevaluate with the school. I believe that some schools are being able to give parents options to change in between each quarter. So maybe you may have one child start remotely and then go in person maybe during the second quarter. So things don't have to sort of be one size fits all for all children.
Absolutely.
So,
Absolutely.
yeah. So, Janelli, in terms of things for parents to look out for or be mindful of when their child returns to school, when the children return to school, in terms of the virtual learning or in person, what are some things that they should be mindful of?
Sure. So I'm sure many parents and caregivers will be focused on their child's physical health and learning when they return to school, but it's important to be vigilant and observe for many signs that can be related to stress and anxiety. We know that COVID-19 has impacted children's mental health, and we encourage parents and caregivers to demonstrate that it's normal and okay for their child to feel overwhelmed at times. Being able to empathize and provide support is so important. So let's keep a few things in mind. Let your child feel their emotion. It's okay for them to be sad, angry, upset, nervous. Their emotions will change often, and you need to show them that it's completely normal for that to happen. Your job really is one, you want to remain calm. You want to listen to your child's concern. You then want to normalize those feelings. And in the process of doing that, you want to remember to speak kindly and always provide reassurance. Caregivers and parents, you know your child best, right? You know that you can have that child that can tell you exactly what they're feeling, but not every child will do that, right? You have to, I mean, my daughter really can't tell. Right now, she's not able to tell me what she's feeling. So you then have to be creative and think of how else do you get your child to communicate those feelings and emotions with you. So some ideas is you can do creative play. You can also do drawing. When you engage in those type of activities, it helps them express and communicate their feelings, especially those negative feelings. It's so much easier to express them, especially because you're doing it in a safe and supportive environment. This helps children find positive ways on how they can tap into those difficult feelings. You also want to check in with them. Find out what are they hearing and what do they think is actually true. There's a lot of misinformation circulating about the coronavirus disease. Children often hear and see more than parents and caregiver realize. So in case there's misunderstanding, you want to address and provide age-appropriate information that they would need in order to keep themselves safe and healthy, as well as appropriately informed. So again, most important thing is to be observant, tune in with their feelings, allow them to tell you what they're feeling. Let's not chime in and say, "Oh, are you feeling this?" Let them tell you. See if they can tell you. And then at the end of the day, the most important thing is providing that support and that safe and supportive environment. That's really what it comes down to, Fatuma.
Those are really great options. And sometimes children may have a difficult time expressing or whether it's identifying what they're feeling and more importantly, verbalizing it, as you stated. What's also very important is what emotional and behavior cues can you pick up on when observing your children? For one, if you notice that there's a significant change in their sleeping patterns, whether they're sleeping more than usual, or maybe your kid is not sleeping at all. So, or if there's a change in their appetite, then maybe they're not eating as much. Another significant change is, are they isolating themselves?
Mm-hmm.
Are they withdrawing from the family? Are they always in their room? Are they shutting down? Are they experiencing crying spells? For a lot of the younger children, maybe they're bedwetting. So there are different things that you may notice in terms of their behaviors, because oftentimes when children are feeling anxious or depressed, they cannot verbalize their feelings. But when we observe their behaviors, we kind of can get a cue that something's not quite right. So there are different things that you can do. Speaking with your medical provider, getting a referral for behavioral health services and counseling, definitely checking in with them. But if you notice that your child is having a difficult time expressing themselves or even talking to you, there are definitely services that are available to assist you with being able to connect with your children. So in terms of some things that, what if you have a child, Janelli, that is scared to go back to school? And with all of the information, they may feel a particular way. How can parents ease their children and provide some comfort because there's so much uncertainty when they walk into the school building if they decide to go to school?
Of course, yes, absolutely. So we know that starting school or starting a new school year can be extremely stressful, right? Imagine doing that during a pandemic, even more stressful. Children may feel nervous or reluctant to return to school, especially if they have been learning at home for months. So parents and caregivers can make their child feel at ease by having an open conversation about what is it that's causing them to feel worried and making sure that they let their child know that it's also natural and normal to feel what they're feeling. Try to be honest and go through some of the changes that they're going to expect at school. For example, you can already start having the conversation if you decide to choose to send your child to school, whether it's the full time, whether it's a hybrid schedule. Try to have the conversation of what that's going to look like or what that may look like, right? Because it's changing every day. So, we know that they're going to have to wear a mask. They're going to see people around them always wearing a mask. And now they're being asked to physically distance from friends and teachers while they're at school. So having that conversation beforehand, it's important because you're preparing them on what they are going to expect when the fall comes. It's a lot of changes. And imagine if it takes us as adults time to process and be able to understand all the changes that we're going through, imagine a child.
Yeah.
So begin by, encourage them to think about other ways to bond and stay connected with their friends and teacher. Explain that the safety measures in place were done to help protect their health and well-being. And also remind them about the positive, right? You want to remind them that although things are different, they will continue to see their friends and teachers, and they will continue to learn new things throughout the years. So the key here is to really always just, provide that reassurance and always check in and find out how was their day, because that's important. We know we really need to take the time to really ask our kids, how was your day today? How did it go? What did you like? What would you like to see different? And that will kind of also allow us as parents, what else can we do, and how else can we continue to advocate for our children?
No, absolutely. And normalizing the experience as well. We're all going through this together. This is relatively new for us. There's no manual that we have to kind of get us through. And, we're doing the best that we can. And we know that you are as well. Another thing to be mindful in terms of things to pay attention to when your kids go back to school is bullying. And so sort of monitoring your children's internet access, social media access. They're going to be online quite a lot. They're going to be
Yeah.
doing remote learning for some of them. And then that's also for some how they, relieve stress. So whether that's going on social media or playing video games. So monitoring the amount of electronic use that your children have. It can be a great distraction, which is great. But you have to figure out, are your children sort of being bullied? Is there cyberbullying going on? Because we know that it was prevalent prior to COVID, and it may be an issue once they're online a significant amount of time. So checking in with them, as you said, Janelle, asking them if they're okay, seeing if they are being bullied, and also the Department of Education has a really great tool and a bullying initiative. So kind of finding out what that is, just in case you need to utilize that.
Absolutely. Yeah, I definitely think it's important because even though we haven't fully transitioned into the school year, we're already seeing some of that. And it's important that we allow our children to understand what that is and to know that there's resources, support, and that they should have a trusted individual that they're able to communicate that with.
Absolutely. And another thing is that sort of doing a check-in, like ask your children sort of what went well, what went well the last few months with the remote learning, if what didn't go well. Have your children identify their strengths, because some children who didn't do well in person actually thrived, working at home. And the opposite may be true, where you may have a child who was thriving in person in school and didn't do so well with the remote learning. So maybe assessing sort of that with your children and having a discussion, as you stated, as to what options may be available this time around and how you can support that and what resources may be available to your kids. Another issue that's come up for many of the parents that I'm working with, Janelle, is sort of, what advice can we give to the parents themselves? I mean, they have the weight of the world on their shoulders. So how can they sort of take care of their needs and in terms of the remote learning and choosing these options, because it's maybe quite stressful for many of them.
Definitely, definitely. So, I mean, let me start by saying that no one was really prepared for remote learning, right? Even us, like working,
Yeah.
from home, or those adapting to like even the social, like the Zoom, we weren't, no one was prepared for none of that. So I really want to say thank you and commend every single parent and caregiver for giving their very best so far. Really, thank you, because you're already making a significant impact in your child's life. So we know that many parents and caregivers are working from home and they're trying to manage multiple work schedules. And on top of that,
Yeah.
keep up with their child's online school expectation. It's a lot. I mean, the main advice I can give parents and caregivers is to try not to stretch too thin. Be gentle with yourself and with others. We all need to let go of some expectations of normal in order to accommodate to our new temporary reality. Please find time to support your own mental well being. It is very hard to do our best if we are overstressed, and it definitely impacts our health as well as our children. Self care is important, even if it means doing one or two things that will help you reset. Like for me, that cup of coffee, like those 5 minutes in the morning to have that nice warm cup of coffee, that is that's everything, right? Like I can't start my day without that. We really need to take a break whenever we can and just find something that we like or enjoy doing or we need to kind of reset. Don't forget that. Also, focus on creating a positive home environment and continue to build quality relationship with children to help them feel secure and confident in uncertain times. Listen, I get it. I know you have that teacher that's constantly telling you, look, the homework is not done. We need to do this. School, everything that they're telling you that your child needs to complete, it is important. But before that, you really need to build on the quality relationship and the time that you're spending with your children, because without that, it's going to be very hard to ask them to do everything else. Throughout the process of all of this, I know it's hard, but we have to remember to stay calm. Children react to what we say and how we say it, right? Even when we think that they don't understand or that they may not understand the nonverbal language, they do. They're like sponges. They observe everything. The calmer you seem, the more relaxed your child will be, which helps children better understand the information that they're told. So maintain and implement routines as well throughout the day, because having a good structure in place will also help you. And we get it. We know it's difficult, right, to have a set schedule, a set agenda, but just try. Try to have a routine in place and an idea of what your day looks like, because children like they thrive. They do so much better when there is a set structure in place. Like, you can keep your daily like your daily wake up time, your daily bedtime routines. But even with having an agenda and a structured schedule, one thing I do have to say, don't make it all about business, 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 and we have to do this. You have to have time to have fun, to relax, to do something as a family together, whether you play a game together, whether you decide to take 5 minutes to have ice cream together, or like, have your favorite meal together. It's so important. So please have fun and relax with one another, because, other than that, doing remote learning, working from home will be so much more difficult. So that's my main advice, Fatuma, and when it comes to adapting the remote learning piece, and also reminding the parents the importance of self care.
No, absolutely. And when we hear the word self-care, it's such a broad term, and sort of what does that mean? Oftentimes I tell parents, you're the teapot and your kids are the teacups.
Yeah.
If there's nothing in the pot, there could be nothing in the cups. So your self-care, your mental health is paramount. That way you can show up for your children, you can show up for your family, whether you're a parent, caregiver. So it's important to also check in. As I stated before, oftentimes you need to assess your children's behavioral cues, but also assess your own. Figure out, are you sleeping? Did you eat? Are you stressed? These are uncertain times, and there's so many stressors in terms of financial insecurity, housing issues, all of these things, the social justice, crime issues. There's a lot of things that we're dealing with as a society, and it's very difficult when you're also worried about how your kids are going to thrive in school if the quarantine and COVID is going to set them back in terms of their education. So it's very important to sort of take a moment and take stock of, how are you feeling? How are you doing? And identifying what resources you have available, maybe contacting some other parents and having a discussion about what this is like, and maybe some support groups, maybe therapy for yourselves as well. All of those things, in terms of the better it is for you to identify and take care of your mental health, you'll be able to show up for your kids in a healthy way.
Absolutely. It's important. It's not easy, right? Because it's easy, we're saying it, but
Yeah,
and it's hard, especially when you're going, all day. Like it's almost like you're in that fast track train, right? Like you're just kind of going, going, going. But we just have to take a few minutes, practice some relaxation breathing, and just know that we're giving it our best, and that's all we can do at the time.
absolutely. And let's say you didn't get the schedule right one day. Maybe tomorrow's a new day. You can
Yep.
always start over, or the next week is a new week. You can always do something different. So, sort of taking the pressure off yourselves as well as the children, because one thing that I've noticed is a lot of my patients with the schoolwork, they're experiencing a lot of stress, making sure that they hand in their assignments on time. Some students do better, in person, on trying to figure out if they understand the material. So letting them know, it's okay. Just do the best that you can. Reiterate that to them, say it to yourselves a few times, and we'll get there. We'll definitely get there. This is new for all of us. So another thing that's come up, Janelle, is sort of with the kids going back to school and all of the changes in terms of the precautions, how do parents educate their children on what to do in terms of social distancing, face masks? Like, how do we sort of navigate that?
Sure, sure. I mean, it's a lot, right? I think the best advice is to approach this conversation with empathy and be gentle while you're having the conversation.
Mm-hmm.
Acknowledge your child's feeling. For example, you can say, "I know you're feeling anxious about the coronavirus, but I'm so glad you're talking to me about it." Right? Children may get upset or frustrated if they're finding it hard to wear a mask, especially when running or playing. You can just make sure to reassure that your child, is doing everything they can and following all the precautions to keep everyone safe. Emphasize to them that it's important that we follow those new measures because we want to take care of our family members and the more vulnerable members of our community. One of the best ways to keep children safe from COVID-19 and other diseases is to simply encourage regular hand washing. It doesn't need to be a scary conversation. You can make it fun. Like I can tell you at my job, we do 20 seconds and we sing the happy birthday song, right? And sometimes I'm like, you know what? That felt a little short. I'm going to sing happy birthday again. And sometimes I find someone that I'm singing happy birthday to. So like, make it fun. Sing along, find your child's favorite song, do a dance together, but start practicing that at home, right? And you can start doing some education at the same time. You can explain that, well, the germs are not visible. They're still there, right? So that's why we need to wash our hands. Because if you practice it consistently at home, it's so much easier for them to mimic that behavior at school. And when children understand why they need to wash their hands, they're more than likely going to continue doing so. The same thing, you can teach them that if they cough or if they sneeze, they can do it in their elbows. If they have the mask, it's okay to do it with their mask on.
Mm-hmm.
And you know what? I know many parents are going to be so caught up in understanding, oh, did my child get sick? Does my child have a fever? Is my child breathing? Take a deep breath. Your child is okay. And even when you start to see some symptoms, you know them best and they know their body as well. So they will tell you, "Mommy, I don't feel well." But if we start putting our children back into the school setting, and then every day we're asking them, "How are you doing? Do you have a fever? Are you anxious? Are you feeling having difficulties breathing?" We are going to make them more anxious, and it's going to be even harder for them to adapt to all the different measures and all the different precautions that they're being asked to adapt to. So just remember empathy and just being gentle, right? Remember that the more we stay calm while we're conveying the different measures and the different things that need to be put in place, the better it is for them to adapt and understand what we're saying.
No, absolutely. And, we know that anxiety and some of the mental health issues like anxiety, depression are genetically loaded. So sometimes if your child is anxious, you can check in, am I anxious? And it may show up differently. Maybe that you're nagging your child or asking them questions. And then, like you said, it can definitely increase their anxiety as well. So we just need to be mindful. And we also need to understand that we could sort of reevaluate all these things as we go. We don't have to figure it all out today. You don't necessarily need to figure it all out by August 7th. Just you can think about it. What is the best decision right now at this time that I can make with the information that I have available? As the school year goes on, you may be able to reevaluate and say, hey, that worked, that did not work. Maybe we can implement this. So you can always, and you will always have options to change that. So and also, like you said, being kind to yourself, being gentle, and sort of also providing positive reinforcement to yourself and to your kids, commending them for the little things that they do, especially if you notice that you have multiple children in the home and maybe you're relying heavily on an older child to assist with homework for a younger child, saying thank you, being able to have those discussions and emotional check-ins. I know something that some parents use or sort of put it on the table Wednesday. So Wednesdays is family night where they discuss certain things. So if there's an issue, they can bring it to the table and they can talk about it. But definitely communication, I think, is key because we're trying to navigate this the best that we can. And we definitely have resources available for you. So we hope that this conversation was helpful in deciding what's best for you and your family in the coming school year. So Urban Health Plan is open. We are here to help you and with all of your healthcare needs. We have telehealth, we have in-person visits available. You can reach out to us and the number on your screen. And so we appreciate you tuning in, and we definitely will love your feedback, and we can continue this conversation, with your therapist, your medical provider, and any of the wonderful providers at Urban.
Absolutely. So again, thank you for your time, and remember, you're part of our family, and we're so happy to be able to provide, resources. And we hope this was helpful. We're definitely going to be doing more of this, and, providing more information and little videos and clips, because we know that this is the new way of communicating with our family, because you're part of our family.
Yes. Yeah.
Thank you, everyone.
Thank you.